any kind of problem, if taken through the motivational interview, things can change. And I find that that's been really helpful to a lot of people that I've talked to. You know, a lot of times they'll say, I just thought I was going to come in here and get my ankle checked out, and you know, here we are talking about something it was just on their mind. So it's a good community service, I think, as well.
I've also had a lot of patients who say it's a great thing, you know, for us to ask these questions because they know our community needs it. We need to find those people that need the help and give it to them. So they like to see that our community has this kind of program.
It works. Like, I think that was what was so cool about us. Like, we weren't really sure how this was going to work because we work with a lot of addiction patients already, but is that all we're going to find? And then like day one, we have a community patient that has some issues and we're like connecting with Tom, we're like, it works.
People respond differently when you ask an open-ended question versus a yes or no, you know? And that makes a big difference just in getting them to open up and talk about whatever their needs are.
It really has. It's opened the door for more opportunity to incorporate the behavioral health specialty into primary care and vice versa, gain our confidence in that arena, and I mean, we wouldn't be where we are today without the SBIRT opportunity.
The ED staff, I think, you know, one of their barriers was, what are we going to do if someone comes in and says, you know, I'm depressed, or if we find out they have a high score with alcohol use, you know, what do we do? And I think it's one of the benefits is that it helps them realize that you don't have to have this huge complicated treatment system or program to intervene with someone right there, right? You can have a simple conversation with somebody and it's really, really effective.
I think it opens up lines of communication. Given where we are, I think there's a high incidence of addiction, a high incidence of alcoholism, high incidence of depression and mental health issues. And so just being able to add that extra service into their visit probably makes a big difference on their overall health.
You might not have all the pieces in place, you can still get going with it. And look, it just helps people. It just does.